Dr. Brian GURNEY is a licensed doctor of physical therapy, a board-certified sports clinical specialist, a personal trainer, and a partner of beFIT'S Therapy Clinic in Manhattan. His primary focus is on movement disorders related to sports medicine and spine injuries. His patients have included athletes of the NFL, NHL, MLB, IFBB, as well as professional dancers. Brian, welcome to the show.
No, thank you for having me.
Absolute
Looking
pleasure.
forward to it.
Look, and I'm very excited to have you on the show because when I got to Manhattan, I desperately needed help. I still do, with a shoulder injury. And I asked around, and for me, the best way to find a good physio is to ask all the top trainers because they're the ones that know. And so I did that, and your name came up too many times for me to not contact you. And here we are.
So it's always nice to hear.
And I'm almost fixed. So awesome.
A little bit at a time, right?
So
it's consistency.
Exactly. So Brian, I'd love to know how you got into physio, how you became a physio, and has that helped your health and fitness journey yourself?
Oh, absolutely. So how it kind of started to be a physio, I was originally going to go to school to be an aerospace engineer, and I was going to go to RIT, all set to go. Month before school was going to start, went to the orientation, and I went there and I was like, this is terrible. I don't want to sit at a desk all day. I need to move. I can't do this. I called my parents up, tell them, I'm like, listen, this is not going to work. They, of course, were very upset and were like, all right, come home. So I went home. We had a little powwow with my lacrosse coach, who was also a guidance counselor at our school, and had a meeting, and we were trying to figure out what I could do. And so I decided to stay local, and I went to University of Buffalo for undergrad, and they were insistent upon that I live on campus. So I think, I'm the oldest of three boys, and I think there was a hesitant about going away from home for sure. And they were like, you got to do it. So lived on campus. That was probably one of the best decisions I made. And then from there, I was like, well, I've always been into sports. Grew up playing hockey, football, basketball, baseball, lacrosse. So I'm like, maybe if I could be a teacher and a coach would be a fun thing to do. So I started taking some history classes, and I was noticing that during these history classes, these professors would get up lecturing for a couple hours, and I'm like, this is awful. I can't do this either. So I'm like, I don't want to be this guy. So I'm like, it all came back to sports for me. Ever since I was a young guy, a young kid, I just wanted to play sports, be involved in sports in some way. And then that kind of led me, and I found exercise science and finished my degree in exercise science and strength and conditioning. And I did an internship at Buffalo Sabres at the time, and that was right up my alley because hockey was my favorite sport and what I grew up playing since I was 5. And then that's how I kind of get into. And from there, I was like, well, with exercise science, I thought physical therapy would be a great combination of combining the two aspects of the field of being with the strength and conditioning and training, working out, and then combining that with somebody who works with somebody who's had injuries and be able to take somebody from an injury and then get them back up to the high level of whatever they want to do, whether they want to be an Ironman or whether they want to get back to playing golf or tennis or skiing or professional soccer. So that's kind of how I got there.
And has that helped you with health and fitness?
Well, for me, it's just my interest is constantly, how can I fine tune the machine? You're always playing with things, talking to different people. I love talking to other PTs and trainers because they're kind of, they're also in it, especially the trainers. I always find they always have some interesting perspectives on different exercises and things and how to challenge yourself differently. So between that, I can really adjust on my thoughts on how I look at the body and how it moves and how I kind of progress myself with whatever goals I'm working towards.
And has anything changed for you over the time, like when you first learned to be a physio?
Oh, absolutely.
Yeah, tell us.
So when I was starting exercising, I was typical, most guys, you go into the gym, you try to lift as much weight as possible. And then did that for a number of years. And finally, then started progressing. And as I got into school and learned more about movement and learned more about the body and how it works, and then just as your body gets older, you feel differently. And so what I discovered was just my style of training changed. And I find now that from when I started working out when I was in high school, doing one day of doing chest, the next day doing back, the next day doing legs, and typical kind of bodybuilding routine, which is great if you want to be a bodybuilder. But I think if you're looking to play tennis or play hockey or play basketball, I think you need more of a total body approach to working out on a daily basis, and a lot of more gear focused on your core and working on your mobility. I think that really makes a big difference on how your body moves to play sports.
Do you think a lot of people have come from that body part split approach?
I would say almost 100% of the males that I speak with, for sure, all started that way. And most of them, a lot of times, still do. They'll come in with some shoulder pain, and they're like, well, I did chest yesterday and bis, and then the next day I do back and tris, and it's the same type of split routine, and they do like 5 exercises, 4 sets, and 15 repetitions, 10 to 15 repetitions for each exercise, which is, if you're going to be a bodybuilder, great. But I think for most people who are just training to get back into sports and just overall fitness, I don't think it's the best way to.
I think you'll find too that bodybuilders, look at Arnold Schwarzenegger, he never trained like that.
Yeah.
So it's interesting to see how people have just adapted that style of training, but that's really interesting. And so I guess I want to ask you, why did you choose physio? I understand your love for sports, but there's other options, right? You could have become an osteo, a chiro. Yeah,
so I think both those professions are also very good, and they're a little different. I think what drew me about physio was more geared towards exercise, because I think that exercise is powerful, and what exercises you can do to help teach people to help themselves, what type of injury they may have, or just how to improve their body in a way that they're going for, can make a big difference.
As soon as I came to your facility where we are now, I could see that exercise was a big part, because you've got this amazing studio. So how do you treat a patient? What's your major?
Typically, my style is manual therapy and exercise. So I will first, I would do a lot of hands-on work, and I found that's always very effective to help with any acute symptoms. So people come in with shoulder pain, they're usually compensating in their bicep. There's usually tightness all around their scapula, and I find that when you're doing your hands, you can really make a difference in how somebody can move and just feel. So if you can make them start to feel a little bit better, and then follow that up with what exercises that you teach them to help correct the imbalances that have developed with their injury, I find that's the most effective way to help somebody get better. And it's really, as a PT, I think what we can teach people to do every day to help themselves is one of the most important aspects of what we do, if not the most important.
So does that mean then really it comes down to what the patient does at home?
So what they do at home is crucial. If they're not following up with the exercises and the instructions that we've given them at home, their success rate is not going to be as good.
Okay, so what percentage of people, and not just your clients, but say in general, they go to a physio, they go home, how many of them actually do their homework?
Yeah, I'm sure it varies across the board, but you're probably looking at 50% maybe.
Really? I think you're being generous. So what about your patients? How many of your clients?
Well, I'd like to say 100%, but it's probably around 60% maybe.
No, I think it's more. So how do you ensure that they do it? How do you ensure?
Well, you try to educate them as far as I really try to instill from day one that this is during the evaluation. I try to point out key factors. So I'll look at somebody's movement in their hip or in their shoulder or their knee and say, okay, what are your here's the key factors of what's causing your problem. So I really try to educate my patient on their injury first so that they get an understanding of that. Mm-hmm. And if they have that understanding, I feel like their likelihood of doing things and following through is going to be much higher. So if they have that understanding first, and then taking them through the process of what exercises to do, and emphasizing to them that the consistency is really important to making the improvements, then I find that they're going to be more successful. And I tell them from day one, I'm like, listen, when you're here, I'm going to work on you with the manual therapy will be really helpful. But then afterwards, following up with these exercises is going to only enhance the work that we do here each day.
I think the other reason why people do their homework with you is you've got an amazing app, which I'm surprised that all physios don't have, that actually gives them the exercises. So many times I speak to people, I can't remember my exercises. So you've got this amazing app that goes over all the exercises, tells them how many they need to do, and they can check it off, which I think is awesome. And I think that's also an accountability thing that sets you apart. So, no, I think that's amazing. But
the app's been very helpful for all of our clients. Everybody likes it because everybody's gotten anybody who's gone to PT in the past will get a picture of a bunch of drawings and here you go and this is what you need to do. But the app, everybody has their phone.
Yeah.
And they're always on their phone.
Exactly.
So if they really have no excuses of remembering what exercises to do, because it's a simple video clip of each exercise that we taught them here, geared 100% for them right there on their phone. So whether at home or they're in their gym, they always know what they need to do. And we've actually just been working on redesigning it so people can keep track of things more effectively and set reminders.
That's awesome.
So
I want to ask you also, how do I know whether to go to a physio, an osteo, a chiro? Why should I go to a physio?
So all three of those are can definitely complement each other in certain ways. I think also with those three fields, you're going to find big differences in individuals' style and theories. So good friend of mine is a chiropractor. So traditionally, PTs and chiropractors don't get along. However, my friend Ray and I are very good friends. And when we talk shop, it's a lot of time the same stuff. He may call it apples, I call it oranges. But we both agree on what we're talking about and what we're trying to do with a particular scenario. Whereas another PT and I may disagree on how they go about it. And typical PTs, a lot of times PTs will have this history of you go into PT, you see the therapist for 10, 15 minutes, they may do a little work on you, and then they pass you off to an assistant who runs you through a few exercises, and then you get some ultrasound and some ice and stim. And we're at our practice here, you won't see me using ice and stim and ultrasound because I just don't find it very effective. And what I want to do with my patients is make sure that they get the most out of their time while they're here. So we find that doing the manual therapy and combining that with exercise is most effective to getting them healthy again.
Why is it that so many physios do this ultrasound, but also what's the other thing that you referred to, the ice and stim?
E-stim, electric stimulation.
Yeah. So why do they do that? I mean, what's the science behind that?
There isn't any science behind it. For ultrasound, you'll see some studies on looking at trying to get people to engage their deep transverse abdominis muscle via ultrasound and using a screen to detect that. But I don't know many places that even have a setup like that unless you're at like a big university type setting. But for the ultrasound for like treatment or electric stimulation for treatment of pain, the studies are very poor. It's not effective. So I don't know why a lot of people still do it. I think it's something that's been done for a very long time and people have not changed. They have not, I think you have to question a lot of these modalities out there. You'll see like people using like a laser now. Again, that's another thing we won't consider.
Are there any other modalities apart from manual therapy that you would sort of condone?
So there's been a lot of stuff. Recently, there's been dry needling has become a lot more popular. And in New York, PTs cannot do dry needling. It's one of only a few states that still can't do it. A good friend of mine's an acupuncturist, and he does it. And I've had it done by him, and I found it very effective for what I was working, what he needed to help me with at the time.
I've also found it effective. Is there much science behind that?
I haven't done any of the research on it, but it was just from a personal account, and it's I've had so far.
So apart from then dry needling and manual therapy, you wouldn't recommend anything else?
No, I wouldn't.
It's interesting you say that then. So really at the end of the day, it's not a matter of should I see a chiro, should I see an osteo, should I see a physio? It's who's the best person. It doesn't really matter about their actual their title. It's more about how they do it. Yeah.
So like for instance, for us, we spend an hour with each one of our clients. Not a lot of professionals do that. So I think, and the most important part in the beginning is how we evaluate somebody. That evaluation time is very important, and how we educate our patients, I think, makes a huge difference for them. And then for me, I find that using your hands and teaching people the right exercises is usually most effective for most orthopedic type injuries to getting them healthy. And you'll see chiropractors that treat that way. I'm sure you'd see osteos that treat that way. It depends where you are and where you go. So if you are looking for somebody to help you when you're searching, I would be like reading their bios, what's their background in manual therapy and exercise, and do they have a good combination of that? And if they do, then I'd give them a try. A patient of mine just moved to California, and he was asking me this very question. He's like, so how do I find a PT out there? So I told him he could look for, so I have a sports clinical specialist. It's like another test you can take after you get your license to like a focus in sports injuries. So I told him somebody did to make a little extra effort into what they're doing. So I told him you could look for that. I told him to look for different manual therapy coursework that they may have done in their bio, and then to call up the place and talk to them and be like, how much time do you spend with your patient? Are they working with assistants most of the time, or are you actually with the therapist? So I think those are really important questions to ask. Do they want you to come 3 times a week, or would they rather have you come once and then maybe come once again for another follow-up? And that style, I think, it can make a big difference too.
So how do you approach that? What's the typical?
So our approach is we get people in, and depends on what their injury is. So if after our evaluation, we can decide together on how much time they need. Do they need to come in once a week? Do they need to come in once a month? That varies based on their injury. And after the evaluation, then we discuss and what works for them and how much we could teach them. And it depends on somebody's background too. Like somebody like yourself, who's been training for a very long time, I can communicate fairly easily with you of what you need to do, and I would get a sense that you're going to follow through. So I'd be confident in saying, okay, Ali, here are the things I really want you to focus on. Let's do this, and then check back up with me in about 2 weeks or so, or a month, and let's reassess. And if we need to have you come in more for some manual work, or do we need to change up your program, then we can do that to help keeping you move forward.
And I feel like there's this explosion of physiotherapy and osteo. Are people getting more injured these days, or what's happening?
I think that just people are exercising more and participating in sports longer and wanting to do things longer, and injuries happen. And I think in gym classes and when you're younger, you just don't get a very good education in how to work out. So I think as a PT and trainer, it's really important how to teach people how to exercise properly. I think some of my favorite patients are when I get my like high school students that come here, and they're like a completely blank slate. So most of our clients are usually in their 30s or 40s, and they've exercised, they've taken classes, they've done sports, they're working, they have their kind of perception of what to do or not to do. But when you get somebody who's 16, 17, and they want to get back to track or they want to play soccer, they are focused, committed, and they listen, and they're ready to go. And you can
mold them.
And you can mold them. You can mold them very well. And honestly, too, their bodies respond very well because they're young. And we do with the body is definitely responds better when you're 16 or 17 as opposed to when you're 50 or.
Absolutely. So do you see that there's a sport out there or a practice that typically results in more injuries, that you're seeing a lot of these people come through? Or is it just across the board in all sorts of group exercise? Just across the board. We see anywhere from marathoners to people who take spin class every day to group exercise classes where like boot camp style classes. And I think what happens in some of the general classes is that it's a class. And you're getting a whole group of people into a class, and everybody's different, whether depending on their background, their age, their body type, their history of exercise, their history of injuries that they may have had. So asking you to squat, and me to squat, and Matt to squat is going to be much different across the board. And so it may not work well for me, or it may not work well for you during a particular routine. So then I think a lot of times we'll end up seeing people because of that too. So if you were to choose a sport for me, let's say I come to you and I go, look, I want to be fit and healthy. What sport should I do? I just want to do one sport. I want to be absolutely fit, absolutely healthy, and I want you to tell me what sport I should do. And I obviously don't want to get injured, because then I can't do it. Right.
So I think even before like a particular sport, doing body weight exercise is probably one of the most effective and safe ways to keep yourself in good shape. Because I think if you can move your own body well, your chances of hurting yourself are going to be much less. So I think when people go from their desk and then they go into the gym and they're like, well, we're going to load up the squat rack with 300 pounds and we're going to get underneath it and let's give it a go. Their body may not be prepared to do that. But if you can do a body weight squat very well, that could be as your progression is key in how you can to get to that point, to put 300 pounds on the bar and be able to squat well.
I like that answer, and I see this movement of movement coming through. Do you see that with your clients?
Yeah, and honestly, for myself and how I train, a lot of the things I do is body weight strengthening exercises, like variations of pull-ups and push-ups and chin-ups, and then incorporating different yoga poses, doing the wheel and crow. I found very effective in helping change how my body feels and how it moves. Learning how to do a pistol squat, that I've challenged myself to do and finally can do it. So I was pretty excited.
Yeah. And do you see that with your clients as well, moving into that, or?
I see that some, but that's some of the things that I try to get across to them more. Because I think what happens, we still see a lot of people who do classes. And I think in general, the classes are going to just say, all right, we're going to push you for this hour, which I totally understand and I get it. Burpees, mountain climbers, squats, lunges, push-ups, planks, and they just repeat it. And you're gonna be exhausted, no doubt. But a lot of times in those particular exercises, some of the repetitive stress injuries will come out as well, depending on your body.
And I guess they've got to ask, what's the purpose? What are their goals?
Sure, absolutely.
And I can't think what their goals might be to do that. But
a lot of times it's just stress relief too. So people work 10, 12-hour day and they just want to just have somebody take them through a class and get it out. That's what I was trying to get my brother to do, because he's an accountant. He sits at a desk all day. And I told him, like, maybe you should go take a class, and it would be helpful to have somebody just direct you through a routine so you can get some stress out and get some exercise in.
Do you see that, say, when you first started to now, do you see a change in the way people are moving?
I wouldn't say so. I would say the typical things that we see are a lot of tightness in the hips that affect the lower back, and then tightness through the upper back and shoulders that'll affect the neck.
And why is that, do you think?
Probably most of the time it's the posture and just sitting, how many hours people spend sitting. What I have seen, though, is definitely a big change, people switching to standing desks. And I would say 9 times out of 10, people feel a lot better. From my patients who've had lower back pain and were sitting for 12 hours a day, and then now they're working on their hip mobility and their core strength, and then they switch to a standing desk, they usually feel a lot better.
So can you give us some tips, standing desk probably being one, of ways that we can avoid injury? Because often it's not actually while you're doing the sport, is it? It's when you go to pick up the bag. Right,
absolutely. So if you can, I've look at one of my 3 points of like looking at somebody's movement is their mobility in their ankles, in their hips, and in their shoulders. So, and shoulders and T-spine, upper back.
And is there one particular place that's more important than the other?
If I would have to just pick one, I would probably say hip mobility, in the front of the hip mobility. So hip flexors, quads. And when individuals have lack of flexibility in the front of their hips, it pulls their pelvis forward. It'll create tension and stress to their lower back. It draws their knee forward, which then will put more pressure on their patella. That will then also lead to their tibia wanting to move forward. Then that can feed into calf tightness and limited ankle mobility. So I think if you could start in the hips, it can make somebody feel a lot better and just how they move.
So what tips would you give for us to, I guess, implement in our life?
So what I would do is if you have somebody assess you how you move, would be very helpful. And then they could properly give you a progression of exercises to do to work on your hip mobility. So it's one thing if I just tell you, all right, let's just go up against the wall and do the classic couch stretch, which I find probably the most effective one for stretching the hip flexors and quads. But a lot of patients can't do that. So they may not have that mobility to even get down on the floor and get their leg up and being able to fully erect their spine in that position.
So the couch stretch, you're referring to the one where they put their foot up like that.
So putting their foot up on, so we use like the wall here. So what we'll do is you go down on one knee in like a lunge position, put your foot up against the wall, back stays nice and straight, kind of lean forward into the front of your hip. Very effective. Give it out all the time. But you'll get a number of people who, when they try to get into that position, that their spine is going to be flexed forward and they can't even fully erect because of the tightness is so bad in their front of their quad and hip flexors. So being able to have that progression is really important. So showing them another exercise on either using a bench or using a strap can then eventually get them there, but so that they understand the concept of what they need to do to help open up their hips, but then that progression of which exercises that's most appropriate for them to get them there.
That's it. That's an interesting point, because I recently spoke to an older lady who went to the physio because she had a sore shoulder.
Yep.
And so she was given all these exercises around the shoulder. So that's all she's working on. And I was like, well, it's a shame that they didn't do a full assessment of your whole body, because you obviously need to squat as well.
Yep.
You want to be able to stand up from a chair when you're older. So that assessment of the full body is a really great idea. Do you ever get many sort of, I guess, requests for that, where they come in and they just say, can you just do a full body assessment?
I do. Okay. That's something that's been happening more often, I would say.
Good.
And then we do that just naturally when we assess people when they come in.
Okay, so that's a really good tip. Is there anything else that we can do to, I guess, prevent injury? standing desk, another thing.
Standing desk is definitely very helpful.
What about like movement throughout the day? Is there a
I think our bodies are made to move. So the more often that you're moving, the better. So whether you need to set a timer on your phone, your watch to get up and move around every hour or so, I think that's good. Or do a few exercises at your desk, whether some body weight squats or some push-ups or just some reaching up and back overhead just to get you out of that position. If you're sitting all day, I think that can be helpful.
Okay. Now I'm going to put you on the spot here because I don't know if you've had this case or not, but have you ever worked with an athlete who was pretty badly injured and you took them from there all the way through to an amazing performance?
Yes, I have. I had one particular guy who was a professional bodybuilder, and he tore his patella tendon, and he wanted to get back to compete in the Mr. Olympia. So after his surgery, it was very humbling for him to try to lift his leg, and even as massive as his quads and hamstrings were, he had trouble even lifting his leg up. So getting him to buy into some of the things that we were doing and how to get him stronger. After a year, he was back on stage and he competed in the Arnold and took second place that year. So,
wow! So how long did it take?
It was a year
from the operation.
From the operation to when he was back on stage. But it was a lot of fun.
That's great.
Yeah,
that's very inspirational because I mean, as an athlete, I'm not an athlete, mind you, but just getting injured is just so disheartening, and you sort of think I'm never going to be able to do anything again. And
right.
So and I'm sure you've got lots of examples of that. So
yeah, it can wear on people for sure, and people want to get back to competing and doing what their goals or sports, whatever they want to get back to,
and that's what I like about your beFIT therapy clinic is that I have this sense that it's not about, no, you can't exercise. It's how can you exercise and what should you do?
Yeah, we want to keep you going.
Yeah, I love that. And I wanted to ask you, if someone's got an injury, let's say their left shoulder, for example, they can't move it and they're like not even at the point where they can rehab. It's just like in a sling. Would you recommend that they do other body exercises, even potentially working on the right shoulder and the right arm, and therefore potentially, I don't know, causing some asymmetry imbalances, or what would you say?
No, I would encourage them to exercise. I think I would tell them exactly what they need to do for their whole body. So whatever their injury is and how it limits them, I'll be like, okay, so you can't do this, this, and this, but you can do this, this, and this instead. And this way you can still get a workout and you can still train. It may not be exactly how you want, but it will help your body keep moving. And I think it does overall help with the recovery. And then as far as like with the asymmetry, I don't think that there's been studies that I've read in the past where they say by even training the opposite side, there's some neurological connection between the other side that helps it recover and get stronger. So I can't explain fully that, but I do think there is a link between that. I believe that. And
I'm glad you said that because I sort of tried to test that theory when I had my shoulder injury. Yeah. And I felt that, of course, my right side got tiny bit bigger and actually I recently tested and it's stronger.
Right.
And there's more sort of muscle mass there. But I felt that maybe even if it was psychological, that it actually the other side got better to try and match it. I don't know.
I think it does. Yeah, okay. Exactly. No, and also when you have like a shoulder injury, you have two sides. So you have that. It's a nice objective measure for you into where you need to go to get it to where you're comfortable and say that to fully recovered. Yeah, so it's a nice gauge too.
Yeah, that's interesting. Excellent. And look, before I let you go, I wanted to ask you why. And apart from the obvious that I've already mentioned, beFIT therapy seems a bit different to a lot of physiotherapies around. And like I said, you're recommended to me highly. Why are you different to the other physios? What sets you apart?
So I think a couple of things that we do differently is that all our sessions are all one-on-one. We see our clients for an hour. You'd be with me the entire time. And then I think our experience and knowledge of how we evaluate somebody and how we educate them helps establish a connection with each one of our patients. So people see that we're taking the time to be with them and educating them and how their injury is affecting them and developing a plan to get them better. And people really appreciate that, because I think in the medical system now, people get shuffled around very quickly. And we'll often hear that, I spent like 2 minutes with the doctor and then they move me on to somebody else, and then this, and then I had to fill out all this paperwork, and they're not getting the service that we want. So I think what we're trying to do here is change how people think about PT and what kind of service we provide. So I think that's a huge factor. And then now with the app that we developed and how people can use that as a tool for when they're at home and they're in their gym, so they always know what exercises they got to do. That's been going a long way. They always have it. It's always there for them. And Eric and I are always available as well. I think because we established that connection with each one of our patients, that personal connection, people will email us when they have questions, and we're very quick to respond. And having that communication with patients makes people feel better. So just knowing that, maybe I had somebody over the weekend fell and they on the ski slope, and they like send me a message, or we would FaceTime and be like, and it just helps people feel better. And I think just knowing that you have somebody like us in your corner to when something does happen goes a long way.
Absolutely.
And that's how our patients recommend us.
Totally.
We want to be your guy. So like when somebody gets injured, we'd be like, you got to go see my guy.
Yeah.
And that's kind of been our approach from day one.
And that's why I know you.
That's
right.
what we've been doing.
I can totally see that.
Yeah.
And what I was very impressed with, just another thing, is that I've got to the US. I have no idea how insurance works, but I remember the first thing you said, look, what's your insurance company? I'll let you know. I'll speak to them. I'll let you know what insurance you've got and what you don't have. And I assume that's just a procedure that you do for all your clients.
We do that for all of our clients.
But I can guarantee you no one does that.
Yeah. No, we know that because we're patients too at sometimes. When we call a doctor's office, and sometimes you'll tell them your insurance, but nobody will give you a direct answer of how much it's going to cost that for your visit, what tests they're going to run, and as a patient, you don't want to get a bill for $1,000 in the mail and be like, what's this? So we try to be upfront with our.
But I found out that I didn't even have insurance, and I'm like, I don't care. I still want to use you because you've looked after me so well, and I haven't even come to an appointment yet. So it's amazing.
Yeah. So and we tell you exactly what it is, and we try to explain what our service is and what you get for your dollar, and it goes a long way.
It's awesome. Now, before I let you go, one personal question I've got to ask you. I ask this to all my guests, so don't be scared. But do you have a tattoo?
No, I don't. I do not have a tattoo.
You don't have like a beFIT underneath your belly button or anything?
No, I'll tell you a funny quote that I heard from one of my favorite comedians that I really like. I'll probably tell my daughter this one day if she ever asks if she can get a tattoo. I'm like, you don't put a bumper sticker on a Ferrari.
I love it. Love it. I haven't had that response before. That's awesome.
This comedian, his name is Sebastian Maniscalco. He's a pretty funny guy.
Really good
My
one.
wife and I watched him a number of times, and he said that the one time, and I did this whole skit on people with their tattoos, and that was pretty funny.
I like it.
Yeah.
Say no more.
Right.
Thank you so much, Ryan. Really appreciate it.
Thank you for having me. I appreciate it.
Thank you.